2 p.m. Now, according to the Speaker of the House, these measures are to curb the spread of COVID-19. Joining us on the show tonight, we have lawyer Sin Yew. Sin Yew, do these rules make sense to you, or do they seem completely arbitrary? From the number of MPs, 80 MPs, from the 41-39 breakdown, from the time limitation, are these numbers just arbitrary?
Hi. Thanks for having me. It makes sense to me. I think we need to scrutinize the rules as a whole instead of just limiting ourselves to the headlines that we see on the news. The limit of 80 MPs is only during the course of the debate. When it comes to voting, all MPs are allowed back in the hall. Now, there are concerns that such a rule would affect parliamentarians' right to meaningfully participate in debates of the Dewan Rakyat. I do agree that this is a concern, but I think that this is something that can be overcome with appropriate procedures being put in place. For example, a total of 66 hours have been allocated for the debate of the 2021 budget. MPs on the side of the government and the opposition could, for example, rotate among themselves and take turns to enter the Dewan to speak and debate. For MPs who are not in the Dewan during the debate, perhaps a suitable area could be designated for them to observe proceedings or meet amongst themselves. The Parliament, as it is, it's full of screens broadcasting the debate, so I don't think that there would be too much of a hurdle. Legislatures measures like this, limiting those who can be present during the debate, I don't think it's something new. The UK Parliament has measures in place since May this year.
Right, but let's look at, yes, since you brought up the UK Parliament, in fact, many other parliaments have changed their rules and they have done in a way using, modern technology in order to maximize the participation, right? So in this situation, what you have is 80 people in the chamber, but the remainder out of 221 MPs, over 100 would now be pushed out of the chamber, and presumably the accommodation of the arrangements there will have to also observe some social distancing rules. So I'm actually quite bewildered by, well, not just the failure of Parliament to have virtual technologies used in order to enhance the session, but now aiming for this kind of arrangement.
Yeah, I do agree with you, Sharaad, that there is nothing stopping Parliament and the members of Parliament to agree among themselves that a new set of rules should be in place to allow remote participation so that everybody can avoid the risk of contracting the coronavirus. This new arrangement that they are seeking to put in place, I suppose, it's a one small baby step forward that such an arrangement is required, and such an arrangement is certainly possible. They do not need to change the law. They do not need to amend the federal constitution to allow for such remote participation by members of Parliament. I suppose the fear is that, and this is one of the fears that was raised by some members of Parliament in the UK Parliament, that when it comes to voting, how do we ascertain that it is indeed that member of Parliament that is voting, rather than someone else that's voting on behalf of that member of Parliament?
Okay.
But I suppose when it comes to that's something that certainly needs to be addressed. But I think that is something that something that can be overcome.
Right.
But when it comes to debate, you would be able to see the member of Parliament on the screen as long as broadcasted in Parliament. So I don't see why, when it comes to debate, people cannot tune in remotely. But I suppose, that being said,
Sin Yew, If I may interrupt you very quickly there, I do want to come back because we're running out of time. I want to come back to the 80 MPs allowed within the hall. As I understand it, each political party will decide on which MPs will be allowed to attend each session. So what about independence? Is this democratically fair? Because we're talking about MPs' duties lie to his or her constituents, not to the political party. And how would that include independence?
Where would Malik be?
Yes, exactly. The latest independent MP.
Yeah, so it's important for us to make a distinction between debating and voting. What is the arrangement here? I don't think much of a case can be made out of not being present in the Dewan, because as long as you register at the main block or parliamentarian block, you are deemed to have attended the sitting. But that could be an issue. What I could see to be an issue is when the chief whip of the opposition, who is in charge of who gets to attend for the opposition and or independent in this matter, do not provide sufficient opportunity for independent MPs to enter Dewan and participate in the debate. Then I suspect a case could be made on the basis that that particular independent member of parliament constitutional right has been denied. But I suspect in this situation, the Speaker would probably have to intervene.
Right. Sin Yew, thank you so much for joining us on the show tonight, helping us make sense of these latest rules for the Dewan Rakyat session. Thank you for your time. We're going to take a quick break here on Consider This, but we'll be back with more, taking a look at what to expect for Budget 2021, tabled tomorrow. Stay tuned to Consider This.
Not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus, be it social distancing, hand hygiene and wearing of the face mask. It's a new norm. Let's not slack. We can do this.
We've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't be lax.
No, the war against COVID-19 is still on. It is our responsibility to adhere to all the regulations set by
Hello, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Budget 2021 will be tabled in Parliament tomorrow, and there's already been a lot of talk about what this pandemic budget should look like. There's been proposals from the federal opposition, interest groups and think tanks. And tonight we'll hear from some of them. First, we have Dr. Khor Kheng. He's one of the founders of the advocacy group, the Malaysian Health Coalition. Swee Kheng, the Malaysian Health Coalition is calling for the 2021 federal budget to commit at least 4% of national GDP to the public healthcare system. Now, this, I might stress, is double the current allocation that is currently given to MOH. Do you see the government making this drastic increase for healthcare? And especially bearing in mind that the government will be seeking to balance competing needs from business, from citizens, all struggling with the economic slowdown and unemployment.
It remains to be seen, and I guess a lot hinges on tomorrow's budget, Melissa. But even if we don't commit to 4% of GDP this year, I think the government needs to make enough moves to increase confidence in the health system by perhaps committing to a gradual increase and very quickly reaching 4% at least in the next 1 to 2 or 3 years even. But it's also important to note that even a 4% allocation, 4% of GDP allocation to health in budget 2021 is not a magic solution to the COVID pandemic that's in front of us. And it's only a partial reversal of the decades of underinvestment in our health system. So while it's not a magic solution, I think it will be a good step forward, and there'll be a few ways that we can think of how to spend the additional funds, Melissa.
Swee Kheng, can you help us understand this number? Because I know in the literature there's some debate about actually a 5% number of GDP said to be emanating from the WHO is much disputed. It says it's kind of more almost mythic rather than real. But help us understand that we're talking about public investment, right? Government investment in public healthcare and not the private sector. And in Malaysia, because we have such a mixed system, what does it do to that number, and where would you like to see government spending go to as opposed to where the private sector is spending its money?
Sharaad, you've asked two parts to the question, so I'll begin with the first part by drawing a distinction between Malaysia and also the OECD countries, a group of rich countries usually based in Europe and North America. Malaysia spends 4% of our GDP on healthcare. That's 2% in the public system and 2% from the private system. In OECD, the number is approximately 10% of GDP on healthcare, 8% from government spending and 2% on private spending. So that's 2 plus 2 in Malaysia and 8 plus 2 in the OECD countries. Of course, this is a gross oversimplification, but it gives you an idea of where we are in Malaysia versus the rest of the world. So you can see that we're underspending for a large number of years compared to other countries who've been overinvesting in their health system for a large number of years as well. That's where we are as opposed to other countries, Sharaad. But let's assume that Malaysia's healthcare system in the public sector receives more funds for budget 2021. Here are some ways in which we can spend it. Firstly, in human capital, which means more permanent posts, not so much contract posts, because we have to signal to our young doctors and pharmacists, ensure that our frontliners are taken care of, because we need to care for their welfare so that they can care for our welfare. That's the first way that we can spend the money. The second way that we can spend the money is in COVID supplies, and I'm talking here about equipment that are consumables like antigen test kits and PCR test machines, but also longer-term vaccines, and also in the super longer-term infrastructure building more clinics and hospitals and laboratories, especially in remote areas like Sabah, Sarawak and Kelantan. That's the second thing that we can spend on, which is infrastructure, equipment and consumables. Thirdly is to provide to as many residents of Malaysia as we can. Right. Obviously, we'll need also to make sure that the funding sources are very sustainable. But the point being that if you have universal health coverage and you can strengthen that in Malaysia, we have some parts of Malaysia having universal health coverage and other parts can be improved. Right. And if you strengthen universal health coverage, will really improve not only pandemic preparedness, but also the routine non-communicable disease care. Okay. And I'll make a final point, making sure that the extra money is spent wisely without corruption, wastage, fraud, abuse and leakages.
Understood. And excellent, I guess, a breakdown of where you're hoping the allocation should go. I'm wondering, Swee Kheng, whether allocation should go to the federal level or should be prioritized and disaggregated to the most under-resourced areas. I'm thinking Sabah in particular.
There are two ways to look at this question. We'll talk about equity. The first way is to ensure that there is a per capita spending on healthcare that is equal throughout Malaysia. Currently, Sabah is underspending. For example, Sabah is underspending compared to the Malaysia average. So for states in Malaysia where they are underspending compared to the you can also look at the outcomes or health outcomes like maternal mortality rates or infant mortality rates, or even the amount of resources available like beds per capita, or how many hospital beds per 100,000 population, how many doctors per 100,000 population as well. And if you can use these metrics to equalize delivery and available resources for Malaysia, this will be a good way for us to try to achieve health equity as well, to make sure that no Malaysians are left behind when it comes to healthcare.
All right, Swee Kheng, in the minute that we have left with you, when you say overinvest, do you mean creating overcapacity? Because I know there's a debate around this, about this. Will overinvestment lead to overcapacity and wastage?
Sharaad, but what we've seen so far in the pandemic response from Malaysia is that our system is being overinvestment will only allow Malaysia to catch up to international standards, and any possibility of overcapacity will be a problem, a good problem to have that we can deal with in 5 or 7 years from now.
Swee Kheng, always a pleasure speaking with you. Thank you so much for joining us on the show. Now we've got on the line Frederik Paulus. He's the economic advisor for the think tank Research for Social Advancement, or better known as Refsa. Frederik, Refsa recently put out a budget 2021 wish list, and in it, called for a widening of Malaysia's social safety net. I'm hoping you could clarify which parts of the safety net specifically need widening, and who is it failing now?
Hi, good evening, Emmett. I think we were advocating for quite a wide rethink of the social safety net. In particular, I think we highlighted not only in our but also in some earlier work that we did that we should look to increase the payouts under the Bantuan Sara Hidup. I think that are currently fairly low. So we're advocating for those to be increased to perhaps the minimum wage level per month, because we see that. Because of the pandemic, among others, we see a trend obviously towards higher unemployment, but also underemployment, where maybe people who had fixed jobs in the past were laid off or got pay cuts and decided to later proportion of the population that is actually experiencing a shortfall in their income. And so hence we think the smart thing to do would be to make up that difference and increase the payout so that they can at least maintain their current standard of living and maintain their consumption patterns.
Right, Frederik.
So that's our reasoning behind this.
Right. Frederik, it's not just Malaysians who are suffering from shrinking incomes. It's also the government, right? With crude prices falling, without the GST and so on. So the revenue base is shrinking. We are looking at the recession is providing some more of that dynamic. Where's this money going to come from? I mean, you're asking government to spend, but surely there might be limits to how much they can spend. And if you're talking about a system, you're talking about a long-term commitment that will be very hard to roll back once it's put in place.
Yes, that's correct. So obviously the fiscal situation of the government is precarious. There is no doubt about it. I think that's also a global phenomenon. So we expect in this budget that we will see substantial deficits compared to the previous years and probably in line with the other countries, both neighboring countries and across the globe. So I think that's one element that is very clear. But I think it's also important. So we're not just advocating for handing out more money, which is obviously an easy thing to ask. And if we just keep the current system and increase the payouts, that's not affordable. That's very clear. So what we're saying is that we should really look at this problem holistically. And so there are many ways to make sure that people's incomes and standard of living are maintained. So one of the things we want to work on as well that we think we should be doing is to increase the productivity in the economy and reduce our reliance on cheap foreign labor usually, so that we can pay workers higher wages and then reduce the number of people who actually need the additional payouts to maintain their standard of living. There's other systems as well, for example, the employment insurance scheme, etc., which are currently only covering about 60% of the people that would be eligible for coverage. So we're also advocating for incentives to get higher enrollment in those programs so that we not only increase the beneficiaries, which is good in cases of rising unemployment such as now, but we also increase the contributors so that there is more money coming into that scheme in general.
Okay.
And then we can manage the costs better.
Frederik,
and then I think...
Sorry to interrupt you. I just want to get your thoughts on, since we're talking about, Refsa's call for more social protection, what do you make of the suggestion to allow contributors to withdraw funds from their account 1 of their EPF, their pensions fund? Is that symptomatic of a failing social safety net for a country?
Well, I wouldn't necessarily say it's symptomatic of a failing safety net, but I think it highlights the sort of acute crisis that we're in for many people, and the risk I see in allowing the withdrawals from the account 1 is that obviously this will put people at a disadvantage later on when they're about to retire and look to collect their pensions. So I think it's probably not a long-term solution, and it might make things more difficult down the line. And then given the current fiscal situation where everybody is pretty much in the same boat, I think we should use this opportunity to keep our long-term prospects intact and then take the hit in the short term and perhaps borrow more or find some systems to where the government doesn't have to get people to dip into their EPF savings.
Right.
Frederik, when you say, expanding the social safety net, are you talking about a kind of welfare state type of scenario? Is that what Refsa is promoting, considering that, the welfare state has been in crisis for, 30 years in the West now? Tell us, what exactly is the model that you're looking at?
So I think we're not advocating, obviously, to replicate tomorrow the welfare states that exist in Western Europe and so on. But I think it's we can derive some useful schemes and systems from some of these welfare states. For example, the need to have a broad pool of contributors for things like healthcare insurance, for employment insurance, and so on. I think these things very much apply in Malaysia as well. So I think without replicating the excesses and some of the disincentives to work and to competitiveness and so on, I think there are certainly some elements that we could try to replicate here.
Right. Thank you so much for speaking with us tonight, Frederik. We're going to take a quick break on Consider This, but we'll be back with more looking at Budget 2021. Stay tuned.
Of the virus, be it social distancing, hand hygiene and wearing of the face mask. It's a new norm. Let's not slack. We can do this.
We've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't relax.
It's a new norm.
We all know the war against COVID-19 is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of a new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
In fighting this virus,
COVID-19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid closed conversations, avoid crowded spaces, and avoid confined spaces.
We can beat this together. The war on COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus, be it social distancing, hand hygiene, and wearing of the face mask. It's a new norm. Let's not slack. We can do this.
We've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't relax.
The war against COVID-19 is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of a new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
In fighting this virus,
COVID-19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid closed conversations, avoid crowded spaces, and avoid confined spaces.
We can beat this together. The war on COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus, be it social social distancing, hand hygiene and wearing of a face mask. It's a new norm. Let's not slack. We can do this.
We've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't be lax.
It's a new norm.
The war against COVID-19 is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of the new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
In fighting this virus,
19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid close conversations, avoid crowded spaces, and avoid confined spaces. We can beat this.
The war on COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus, be it social distancing, hand hygiene and wearing of a face mask. It's a new norm. Let's not slack. We can do this.
we've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't be lax.
It's a new norm.
The war against COVID-19 is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of the new norm.
Allocated a total of 6.5 billion in this year to restructure our nation's employment landscape by reducing our dependence on foreign labour and allocating funds to provide training to the local workforce, and this could create numerous jobs post-pandemic. So this is the first thing, is about how to create the jobs. The government should have the program to create the jobs. Secondly, is about how to assist our SMEs to sustain, revive or achieve transformation, especially digitalization. So majority of the SMEs now are forced to move onto online platforms to decrease the operational costs by laying off the employees, and some would also sell their goods through the live streams. So we have seen the rise of the gig economy throughout Malaysia during the pandemic. So I think how to address the issue of the digitalization of the SME, how to train them, how to train up the youth, okay, to engage in more in this online economy is very important.
Yeah, so you outlined some really important issues. I wonder if the government of the day, at federal level, rejects the confidence and supply agreement and some of the kinds of proposals put up there, if they reject the kinds of demands that you're making now, will you support this budget?
Okay, I don't think they would just outright to reject some noble intention of our proposal, such as the National Fiberization and Connectivity Plan. In fact, was started during our time when Gopin Singh was the minister. So this National Fiberization and Connectivity Plan and FCP would be still continue in Sabah, and we call on to continue with this, and these are nothing to do with the CSA.
Right.
So I think we need to differentiate the issue of the CSA and the support to the budget.
I'm sorry to have to cut you off, but we have run out of time. Thank you so much for speaking with us, and we all look forward to know what is going to be tabled in Budget 2021 tomorrow. Thank you. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off the evening.
Thank you so much for watching. Good night.